According to several studies, it is estimated that 40% of Nigerian adults have hypertension. So we're talking about somewhere around 76 to 80 million people grappling with this silent yet deadly condition. Let's get it straight. Hypertension isn't just a number on a blood pressure monitor. It is a major concern, a major public health concern, that if not checked on time, it can cause cardiovascular diseases, kidney failure, and even stroke. Now, did you know that only 1/3 of the people diagnosed with hypertension in Nigeria are receiving any form of treatment? And only 18% of those that are hypertensive in Nigeria have their hypertension adequately managed? I guess that will be shocking to you. Why does this happen? Surely top of that list will be one, low awareness about the disease. People don't know well enough about the condition. They don't understand how deadly it is, and they undermine the risk factor. Number two of that list will be limited access to healthcare services. Still today, we don't have enough infrastructure in Nigeria, and people cannot afford healthcare. Number three will be insufficient healthcare screenings, as a lot of people still do not undergo routine comprehensive testing, and that's a big issue. The fourth on that list will be a prohibitive cost of medications, as many Nigerians still cannot afford medicines, among others. Now, addressing this gap is essential for improving the cardiovascular outcome and also saving lives. Remember, we want to save lives. At this point, I'd like you to come a bit closer, and I want you to listen a bit more attentively, because we want you to understand this condition. And in understanding hypertension, you got to recognize that it's got risk factors. And these risk factors are divided into two, the modifiable ones and the non-modifiable ones. Let's start with the modifiable ones. First on that list would be unhealthy diet. A lot of people take high amounts of soda, and they develop a condition where they have high sodium and low potassium level, and this can cause your blood pressure to skyrocket. People take processed food that contains unhealthy fats, lacking vegetables and fruits. This can be problematic, and it can worsen your blood pressure. If you're in that category, you got to cut down on these kinds of food. Next will be physical inactivity. Research shows that roughly 58 to 60% of hypertensive individuals lead a sedentary lifestyle. This means they are stuck in inactive jobs and they are not engaging in enough physical activity. It is clear that physical activity is a pressing issue that exacerbates hypertension and other cardiovascular disease. A sedentary lifestyle does not only contribute to obesity, it can lead to poor cardiovascular health. Now, speaking of obesity, excess body weight, it adds to the strain of the heart, and inevitably, it can raise your blood pressure. Excessive alcohol consumption is another very relevant factor. A lot of people engage in binge drinking and excessive consumption of alcohol. Alcohol can elevate your blood pressure, and this is not good for you. Tobacco smoking is another factor, and it can harm you by raising resistance of your blood pressure vessels that can further worsen your blood pressure. Likewise, is caffeine intake, which may temporarily increase the risk of developing hypertension. But it's not just about what we consume. Stress is another very significant factor, as chronic stress can lead to temporary spikes in your blood pressure and encourage unhealthy habits like overeating and smoking. Diabetes often coexists with hypertension, so controlling your blood sugar is a crucial strategy for lowering your blood pressure. Finally, let's not forget the role of poor sleep patterns. Sleep disorders like sleep apnea are closely linked with the risk of developing hypertension. Now let's move on to the non-modifiable risk factors that we need to consider a bit more. Top on that list will be age. Age is a significant factor, as we grow older, our blood vessels stiffen, and this can increase our risk of developing hypertension. Genetics and family history of individuals is also another very key factor. Men tend to have higher rates of hypertension in early life, where women tend to develop hypertension after menopause. Let's not overlook the importance of ethnicity, as people of African descent are more prone to developing hypertension compared to the Caucasians. In managing hypertension, it is crucial to ensure that we have our blood pressure controlled. Guidelines recommend that we should aim at 140/90 mmHg for the general population, and even aim a bit lower for those of higher risk, like those having diabetes. So we're looking at targeting at 130/80 MMHG. Regular monitoring is key to maintaining a sustained control over time. That's why it's important for you to have a BP monitor at home. Remember, buy one and keep at home. Equally important is adherence to prescribed medications. Patients need to take their antihypertensive medications consistently without frequent missing of doses. See, managing hypertension isn't just about a number in your monitor or a number to control. It's a comprehensive approach that is aimed at reducing hypertension and preventing its complication. So by addressing these issues and raising awareness, we can take giant strides towards better outcomes for millions of Nigerians suffering in silence. And remember, always consult your healthcare professional in this regard. Stay informed, stay encouraged. Remember, your health journey matters. Let's continue to explore how we can tackle hypertension and improve the cardiovascular health of our people together. Thank you.